Hello, good morning. Welcome once more to Ask Your Midwife. I'm Patience Efrifa, a senior staff midwife. Today I'd like us to briefly talk about importance of scan, or why the need for a pregnant woman to do a scan or to take a scan. This topic is very important because at times when a midwife or a specialist requests a scan, others take it for granted and end up discarding the paper or misplacing the paper. But as a pregnant woman, though we assess you, we take care of you, but the scan tells us what is actually going on within the uterus, what is happening to the baby. At times when you are pregnant, you may be for the first time or during your first trimester and you are about to start your antenatal, your midwife may ask if you've taken a scan before they give you this red booklet, or if you've done a pregnancy test to also confirm that you are pregnant. Yes, the reason why mostly they ask for the two, that's the pregnancy test and then the scan, is simply because the hormonal one, the cassette which is used to do the pregnancy test, anything can alter it. That's the urine one, anything can alter it. So it may read positive, but you may not be pregnant, okay? Because that's the HCG, that's the hormone HCG, which the cassette of the pregnancy test kit is supposed to pick up. That HCG is a hormone that is being released by the yellow body or the corpus luteum when an egg is released and it meets the sperm for fertilization. That yellow body releases that HCG, yes, into your system or into your blood, and that is what will also show in your urine test, or there'll be traces of it in your urine that will indicate that you are pregnant. But anything can read positive, that is, even if you are having myomas, it's possible that your HCG can be positive yet you are not pregnant. That is why we always ask you to do a scan. The scan will confirm, will be a second confirmation that indeed there is a viable fetus there. All right, so this is a sample of a client scan. So those who don't know how a scan looks like, this is how a scan looks like with a picture. There are certain places that there's a possibility that you get it colored, but this one is black and white. So this is how a scan looks like, and the findings are also written here. So this is just a picture of how your baby, how the uterus looks like, where the placenta is lying, but the findings are also documented here. Others will also type it. It depends on where you took your scan or the facility you took your scan, but the findings are the same. All right, so with the scan, the importance is that apart from it being serving as a diagnosis for us to confirm that you are actually pregnant, it also, as the pregnancy advances, your midwife may request series of scans. Ideally, you're supposed to take at least 3 scans. That is, the first one is when you're coming for your first visit, that's to take your antenatal booklet. Then the second one is the anomaly scan, which you do at 28 weeks. Because at 28 weeks, it is believed that the baby's vital parts or organs are fully formed, or features are formed. So if there's any abnormality, the scan will pick it up. So at 28 weeks, you do your anomaly scan. Then at 34, 36 weeks, or ideally 36 weeks, you do the third one, because that time the baby is fully formed and fully ready for birth. All right. So we have, though you are supposed to take the scan like 3 times, but your midwife or your doctor may ask you to do more than 3 times, depending on the condition of your pregnancy, depending on the complaints you present with, depending on the findings the doctor or the midwife identified. He or she may request a scan to assess further, to probe further, to know what is actually happening to the baby in uterus or in utero. All right, so at times the scan will let us know the location of the placenta. Ideally, the placenta is supposed to be fundal. When I say fundal, let's say, for instance, this is my abdomen, so it should be top here. So the top here becomes the fundal. It's ideally supposed to be there, but there are instances whereby some of the placenta don't locate themselves where it's supposed to be, and they end up being at the lower part, which is closer to the cervix. So that one, and if it's closer to the cervix, when the placenta is closer to the cervix, the scan will also tell whether it is completely covering the cervix or it is partially away from the cervix. That one even will help the one attending to you to know if you can deliver through your vagina. Okay, and then at times too, these scans also help us to know whether the placenta has started separating. At times you can go and take a scan and then you realize that there'll be bleeding somewhere. There'll be bleeding in between the placental sites and then the walls of the uterus, and that one we call it placenta abruptio, and it is an obstetric emergency. It is an obstetric emergency. That one will also help the doctors to quickly intervene for you. So my mothers, my clients, scans are very, very important. We shouldn't take it for granted. Scan can even tell us whether your cervix has started opening, because ideally your cervix is supposed to be closed. So when the cervix has started opening, that means that the baby is threatening to spoil. That is what we call the threatened abortion. So scans can be able to, it's a diagnostic tool. It can diagnose so many things. So let's not take it for granted. Aside that, it can even tell the baby's weight before you give birth. At times when you are in labor, your doctor or midwife will just want to know your estimated fetal weight, because the scan can estimate the fetal weight. So the estimated fetal weight, if the baby's weight is more than 4 kg, then the doctors can even intervene to say that this is a big baby, so we have to do this for you. The doctor will not stress you for you to go through normal vaginal birth, and at the end of the day you can't push the baby because the baby will be too big for you. So scans are very important. Thank you very much. As usual, if you have any question, don't hesitate to ask. Thank you so much. Bye.